Hey guys, I'm Daniel from Dolder Media, and today I'm on an interview with a program director at a local respiratory college here in Sacramento, California. And I got some really good questions, and I think he's going to have some really good answers for us. So here with me, I have Robby Nijjar. He's been involved with respiratory care for 24 years now. He's worked at several of the local medical centers and has been involved with education for 16 years. He has been a notable advocate for the profession for respiratory care with his involvement with the California Society for Respiratory Care and American Association for Respiratory Care. He was the Northern Californian president for CSRC and chaired the Government Affairs Committee that was responsible for updating the minimum entry standard for licensure for the state of California. He also represented the profession in conjunction with the AARC at the national level while advocating increased role for RT within telehealth. Currently, he is the program director for respiratory therapy at a local college and a lifelong proponent of the profession. Tell me a little bit about yourself. Why did you become an RT?
Respiratory therapy is not one of those things where, as a child, you're growing up and saying, I want to be a respiratory therapist, although I have seen two students now who actually had that aspiration. But generally speaking, people want to be in healthcare, and then as their process of discovery leads them to different professions, respiratory therapy typically comes up. So my specific story is that I was interested in healthcare, and I really wanted to get into physical therapy, and I was doing my prerequisites at Chico State at that time. This is in 1997.
Okay, 1997.
And I just happened to be driving by a college that also offered respiratory therapy program. A friend of mine had recommended that's something that I ought to check out. So I remember on a Friday afternoon, I actually went to this program, and I had the pleasure of meeting with the program director that day. They were available, and then they showed me around. And I felt like it was the right fit for me at that time. And they told me that classes are starting on Monday, and there's one open spot. And I felt like everything was just aligned for me to go ahead and just say yes.
How common is that for students to kind of fall into respiratory? Is that more common than not?
I do feel like it's a story of discovery. Majority of the students that I see, they had aspirations of being a physician assistant, doctor, nurse, and as they're going through those discovery sets, they recognize, there's so much more to healthcare. There's radiology, there's pharmacy, and then there's respiratory therapy.
So it's funny because a lot of the people watching this channel actually are going for other professions, and they stumble upon respiratory, and they're like, wait, what is this? Yeah. So I'm guessing at school that's probably a common thing. Do you guys, before applying, ask what other aspirations the people had?
Absolutely. Because, as you know, healthcare is a calling. And within that calling, you try to see, what do you want to specialize in? I know it's all one tube, but it's all about which end of the tube you want to really specialize in. Majority of the people that I see as my students, they're okay with the sputum, but they're not okay with the feces.
Oh yeah.
Right? So that's like one determining factor. The other is specialization into cardiopulmonary aspects. That's something that's intriguing to a lot of my students.
Okay, now so for people that don't know what cardiopulmonary is, what would you classify as cardiopulmonary for anybody who doesn't know?
Yeah, I would say it's everything from the chest on up.
Okay.
Everything that's in the thoracic cage, which is your lungs, your heart resides there, and then the airway, breathing, and circulation.
So do you think respiratory therapists become masters of cardiopulmonary services, or do you think they're just more of like a help to the professionals, to the masters? How, in terms of expertise, how much of an expert do you eventually become as an RT?
I feel like to be a proficient respiratory therapist, you do indeed need to be an expert in the cardiopulmonary aspect. Our colleagues in nursing and physicians, they do have good understanding of the cardiopulmonary system. However, they rely on us for our expertise, especially when it comes to assessment.
How long do you think it takes for someone to become an expert in the respiratory? I know everybody's a little different, but generally nobody's going to graduate and become an expert. Is that something that comes over time, or is that something that's guaranteed?
In my experience, the average time to where you start to feel like you have mastered the skill set is about a year and a half post-graduation. So I typically see that in the first year you have pretty good fundamental understanding of what respiratory therapy is, but you may not have seen enough situations to make the correct connections. And it does take about a year and a half for a majority of my graduates to
So a year and a half
master.
to become competent. Okay, like really comfortable with.
I think they're competent day one.
Day one, they're competent?
But it's the comfort level and really taking it to the next level. Because competency has to be there. Society expects you to be competent day one, right?
Okay.
It's any of our loved ones that could be in the hospital setting. So you have to be able to recognize the ABCs, right? But then when you go to DFG, that requires taking the information that you already have built in, relating with fundamental experiences, and really start to take the blinders off so you start to see the clear picture as to what's going on.
So I have a question that people always ask me online, and the most popular question, I get a few questions, and I'm going to get through them today. So one of the questions is, how much math do you have to know to become an RT? It's funny because I don't know where people think that math is so heavy. This isn't physics, but that's a very common question. I get that almost every video. Somebody asks me, how much math do I need to become an RT? And if I'm not good at math, can I still succeed?
If you're interested in getting into healthcare, you're going to have to demonstrate your understanding of basic algebra. And basic algebra is the level of mathematics that you really need to succeed in respiratory care. Anybody who's kind of trying to see the level of mathematics, I would advise them to go to nbrc.com. We could probably embed that into the description of this video.
Okay, and you said nbrc.com?
Yeah, that's the National Board of Respiratory Care.
Okay.
And they actually have some sample questions for the board examinations. And some of them demonstrate what the mathematics requirement may be. So if you're familiar, with, for example, cardiac output, right, requires simple multiplication, or minute ventilation requires simple multiplication. But the alveolar air equation requires a little bit more mathematics. And it's not so much the crunching of the numbers that you really need to know, it's the formula, right?
Okay.
So the understanding of the formula is really where the value is, because we'll always have access to the calculator and the computers. They will churn out the number for us. But we need to understand the fundamental aspect behind the formula.
Okay, so pretty much there's going to be a lot of formulas to know. So in my personal experience, actual on-the-field RT work, not that much math. You just kind of have to know the basics of making sure that your dosage is correct. But to get through the school part of it, you have to understand how it works. So there's a lot of math involved, but the math is just formulas. And that's kind of what you're saying right now too.
Well, in school, we're preparing you for the board examinations. And when you take the board examination, you're practicing in a hospital called the National Board of Respiratory Care Medical Center, and they have a specific set of rules. And this is a way to demonstrate competency at that particular workspace. So you have your work experience, but other people may be working at more progressive medical centers that requires a lot more mathematics. They might be looking for alveolar air equation or A to A gradient deficit to determine early onset of ARDS, right? So, and you do that in your job already as well, and to you it's become basic because you do it so frequently.
I think you're right. It gets so comfortable.
And that's the thing we sometimes forget as practitioners is like, you know what? I have the understanding of the formula and the concepts behind the formula. So it's not so much the calculation. And once you've done it enough times in a clinical setting, right, it becomes second nature to you.
So you're right. I think that when you're in school, it seems a lot harder, like you're doing a lot more, but it just kind of becomes natural.
Absolutely.
I don't know of anybody that complains about math. Now, we have a lot of people that I work with and I've worked with that are not good at math, but no, I don't hear anybody complaining about the math in the job. So if you are worried about math in terms of becoming an RT, I think that should be the least of your worries. There are a few formulas, and you were saying NBRC. And then what do you do on nbrc.com? You go to like a practice test for the...
I could share a link with you that'll take you directly to the examinations, examination-related questions that NBRC offers for free for anybody to take and try to see if this is something they might be interested in.
Okay, that's actually, I think, very helpful. So what students do you think succeed the best? Like, is it the hard workers? Is it the outgoing ones? What if you're an introvert? What type of student succeeds in the RT schools?
That's a great question. The type of student that I've always seen or have seen to succeed is the type of student that has the right mindset, number one. So the mindset really has to be a learner's mindset. And I can elaborate a little bit more to as really what that is. A learner's mindset is basically you're coming to a college and you're saying, look, I want to work on my weaknesses, right? And I want to upgrade my skill set. So if you have that type of a mindset, that student is going to succeed because they're open-minded about things, right? When we bring areas of improvement to your attention, you're not going to look at it as a negative development. You're going to look at it as a constructive criticism, right?
Yes.
So you're here to work on your own self and your own learning and upgrading your skill set. If you have that good mindset, you're going to succeed. Now, there are other things that also I see with my successful students. They're generally more organized. They typically plan out their day. They have a good understanding of what the resources are that they're tapping into. And they understand the fact there's only 24 hours in a day. And within those 24 hours, we have to determine how we're spending our time, right? If there's a lot of distractions, then you have to eliminate them, right? So if we spend a lot of time on Xbox or Netflix, well, the future outcome may not be as good as somebody who's not doing that. So students who are organized, students who have the proper mindset, and the students who are willing to get involved are the ones that I typically see getting not just success in passing the RT program, not just success getting a job, but they thrive in the profession. Okay. They're the ones who immediately go into leadership positions. So I feel like if you embrace the fact that you're going into uncharted territory and you have a lot of learning to do, then you're going to be successful in this particular profession.
So what about students that are struggling? If they're in an RT program right now and they think they're doing really well, what advice do you have for them to help them to actually get through the program?
So it's difficult to know what their individual issue may be, but I would start by identifying really what's holding me back. But if you, for example, have a student who's struggling in the program, I would imagine they're comparing themselves to their peers, right? Like my fellow classmates seem to be a lot more integrated or their knowledge level is a lot better than mine might be. Immediate fix would be, okay, number one, you got to look at what the distractions are for you and start to eliminate them.
How would you determine what are distractions? Because some people, they think that like TikTok or Instagram, they think it's part of their life. Is that a distraction? How would you determine what is a distraction?
Yeah, I would say if you're behind in any type of a healthcare program or any program, basically what you need to do is you need to unlock packets of time. So you really need to look at what are things that are consuming my 24 hours a day. Of course, you're only operational for about 10 hours in your day anyways. We all have to sleep. We're all human beings. So 8 hours are gone. A couple of hours are gone for a commute, right? You take another hour for other activities. And then the remaining time is what you have to really focus on yourself. And if within that you have TikTok time, Netflix time, Xbox Live, whatever it may be, you would have to eliminate them, especially if you're noticing that you're behind everybody else. I would advise you get an organizer and start to plan out your day, map it out, and then stick with that plan. The other thing you could probably do is get with students who you feel are doing quite well, right?
So find somebody who's doing well.
Find somebody who's doing well.
Okay.
Figure out what are their best practices. Like, don't take my word for it. Like, what are they doing correctly, right? And it becomes pretty obvious that they must be spending their time focused on the right activities, right? And then you could learn from that. And then you could also, another thing I would recommend is develop a study group. Having a study group really helps you.
How large should the study group be? Because I think
Yeah.
there's a certain point where it gets too big or too small.
Sure.
Is there like a number where you would recommend a size of a study group?
Yeah. First I want to talk about the value of one having a study group,
Okay.
because people are able to look at things that might be your blind spots, right? So now linking it with what your second question was, a study group should probably have 4 to 5 students. I feel like anything more than that probably becomes more of just a review before the test type of a group. But really, those 4 to 5 members of the study group need to excel in areas where you're deficient. So for example, your earlier question about mathematics. If you struggle in mathematics, you need to have somebody in your group who exceeds in mathematics, right? So they can bridge that gap. If you struggle in science, you should have somebody in your group that is proficient at science, right? And then you yourself, you're going to bring some value as well to the study group. And when you start to put those components together, the study session becomes that much more powerful.
So that's a really good advice, because I think most times I've talked to people that study, they get like-minded people that are struggling with the same topic, and they try to figure it out on their own. But you're saying the best thing to do is get someone proficient in it and study with them. Absolutely. And then also kind of bounce off, because you might be proficient in something they're not.
Absolutely.
So that's actually really good advice. I never honestly even thought about it like that.
The danger with like-minded people, and we're human beings, we want to be around like-minded people when we party, etc. But when it comes to your education, when you're around like-minded people, all it's going to do is create a narrative as to why everything else is unfair and our approach is the right approach. Well, that is not going to be conducive to learning, right? So you're going to learn some very, very difficult, hard life lessons, which I would want to avoid, because again, we're talking about time. Time is like a limited commodity for a human being, right? You don't want to waste a couple of years before learning these valuable lessons. So, I think this is what this engagement is about, is to help future students who are getting into healthcare recognize some of these things early on, so it really helps them flourish in their career pathway.
Okay, perfect. So students that are in the program, their biggest problem is they're probably not good with time, and time management is something that's going to probably help them the most. Cutting out things they don't need, some kind of time thing. What about students who they're thinking about becoming RT, they're not even students yet, they have all the time in the world. What do they need to do to prepare to become an RT? I have people ask me, what book should I buy? And it's always like, I don't know, you'll learn everything in the program. So what advice do you have for people that want to become an RT? They applied and they have 3 months they're waiting, or 6 months they're waiting. Yeah. What should they do to get better at the program?
In my opinion, that is a very good position to be in, number one. If you've applied to the program or you're in the process of applying and you have 3 or 4 months before the program actually starts, my advice is you go heavy and you work a lot. And you do that to save the money that you need for a rainy day fund. Here's what typically happens is majority of my students are working some sort of part-time job, and then they're going to school. But what if you could eliminate that part-time job? Do you know how much more time it would unlock for you to focus on your studies? Now, studying and going to college isn't about people who are super, super smart. Going to college is about taking the time that you have and applying it on what you need to learn, right? So the equation becomes super easy. If I take more time and apply it to my studies and upgrading my skill set, then of course my outcome is going to be more superior than somebody who doesn't do that.
Okay,
right?
So the best advice right now
is to
work
go
as hard
in,
as you can, save as much money.
Work overtime, right? Take on a second job, save as much as you can, because when the program starts, then you could just focus on the fundamentals of the program, and you can stay one step ahead of everybody else.
Yeah, that's really good. You know, when I was going to school, I had a full-time job and I had full-time school.
Yeah.
And I didn't see people for about 2 years. And honestly, I still have friendships that I've never mended because I had no time to see anybody. But maybe had I had the money that I saved up, because I wasn't planning for that. That's pretty good advice. So work as hard as you can so you could have a rainy day fund. That's probably the best advice. Honestly, that's because people have asked me, and I don't know what to tell people. Like I don't want to tell them to read Egan's.
It won't make any sense, right? You really need somebody to guide you through the program. So it's not like, hey, here's a map and here's your journey and go ahead and do it. You're just going to waste a lot of time. Or you can hire an expert. Say, hey, this is a person who's actually done this journey before. They can walk you step by step, and it becomes a more enjoyable process.
I have a question about now after you graduate.
Sure.
So what if somebody is struggling to find a job? I know the market is, do you know what the market future is?
If I knew what the future was, you and I wouldn't be sitting here.
That is true.
Right?
That is true.
But the best thing we can do is we can project based on previous knowledge. And I've been involved in this position for the last 16 years. So in those 16 years, I've seen so many different markets where you have a market where if you have a pulse and a license, you have a job. I've seen markets where you're the valedictorian of the course. Or your graduating cohort and you're struggling to find a job. And I've seen every variation in between. But there's been one constant through it all. And it's been that people who are willing to go where the jobs are, they have no issues getting employed. So even the worst times, there were parts of this nation where there are more jobs open than people applying for them, right? So I think the post-graduation placement, which is how we track employment, for us, that's the most important metric. For me personally, that's the most important metric. I want to make sure every graduate from my program gets a job at the end. So we actually have that discussion before the student comes here for day one. They meet with me, we do a formal interview, and in that interview, we talk about possibly having to relocate to get a job, right? So we need to actually have that discussion. We need to plant that seed.
So when we're talking relocate, are we talking 100 miles? Or are we talking different states? What is the typical recommendation, or how far are you telling people to go?
I would say all of the above. If you know of anybody who is in healthcare, somebody who's a medical doctor, somebody who's a physician assistant, somebody who's a pharmacist, somebody who's a nurse, or somebody who's a respiratory therapist, a lot of times they will tell you they pretty much traveled the entire nation before they settled where they are now, right? So they may have gone to school in this state, then they went to their externship in this other state, then they got their first job here, and now they relocated here. That's kind of the expectation in healthcare. Now, I hope when somebody graduates from my program, they get the job that's within a few blocks of where they already reside, right? That's a dream scenario. Who would not want that? I want that for all of my graduates. But it's not something that is going to happen for them, especially all of them. So really, you want to make sure when you graduate, you've allocated so much time, so much effort, so many resources, and your family members, your support system has made so many sacrifices that you're going to be willing to go wherever that job is. Now, this does not mean if the job is in a different state, that's going to be your future from here on out. We're talking 9 months to a year, and then you keep an eye on where you actually want to work. Once they have a job opening, now you're the prime candidate. And the reason for that is employers want one thing and one thing only. They want flexibility. And you just demonstrated that. You said you were flexible enough to go to a different state to get a job and to get your experience. They know if they brought you into their team, you'll be flexible enough to cover whatever their gaps may be.
So it's funny because actually now the more I think about it, every time you look at a doctor online on a registry, they went to school in like Boston.
Yeah.
They lived in Massachusetts, or I'm thinking of Boston,
Yeah.
but they lived in another state and then they work in this state.
Yeah.
So yeah, you're right. I think medical is a very nomadic kind of field.
I have MD friends, who went to school in Arkansas or Minnesota or Michigan, New York, that they had their residencies in states like Florida, Nevada, and then they kind of settled here in this region.
That's
right?
true. Many doctors they're not from here.
No, absolutely.
You kind of relocate. So the best advice for people that are struggling to find a job is expand where you're looking. But what about if you got a California license, does that mean you have to retest in another state? Or will those jobs provide for you if you do get hired? What do you do about that?
Yeah, no, actually that's a great question because licensure is actually predicated on credentials. You take the board examinations from an entity called National Board of Respiratory Care, and California actually has the highest standard in respiratory care. And in my intro, you mentioned that I worked on the licensure practice for California, and that's something we looked at quite heavily. We tied the entry level to the registered respiratory therapist credential. That is only active in about 5 US states as of 2023, depends on when you're watching this video. Majority of the states, they tie their licensure on the CRT, which is the entry-level examination. So that credential travels with you throughout the United States, also in some European nations, also in some Saudi Arabia, or some Middle Eastern countries, like Saudi Arabia, for example. So all you have to do is apply to, let's say the state is Florida. You would apply to Florida's Respiratory Care Board. You would pay the application fee, and then they would grant you licensure based on your credential, that the fact that you already passed the examinations with the National Board of Respiratory Care, now you can work in Florida, for example.
What if you are from Florida and you want to go to California?
Yeah.
So then you would have to go to a higher level of testing?
Maybe, maybe not. It depends. If you've already taken the CRT examination and the RRT examination, then there's no further testing required.
So generally speaking, if somebody's trying to go to another state, there's not going to be too many obstacles. It's going to be overall pretty smooth. And you're saying that the licensing has transitioned over to more of a higher standard across the board. You said there's only 5 states that kind of expect to hire. Or is there going to be more states that want people to get the RRT versus the CRT?
You know, in some of the advanced circles, they're having those very discussions, right? If you talk to society or community, and you told them, hey, there's 2 standards in respiratory therapy. One is a certified respiratory therapist who's demonstrated entry-level competency. And then there's a registered respiratory therapist who's demonstrated advanced competency. Who would you like to be taking care of you or your loved one? Of course, everybody would say the advanced practitioner, right? Or somebody who's demonstrated advanced competency. So a lot of states are looking at that data and saying, well, why don't we make that the entry level for respiratory therapists? Because you're working with people at your job, and they're all doing the same exact tasks, whether they're CRT or RRT. But what state of California did was, after 2015, anybody new coming into the profession has to be a registered respiratory therapist in an effort to upgrade the skill set.
Okay.
So other states are looking at that very aspect. But to answer your earlier question, if you have credentials through testing from NBRC, those are going to stay with you no matter which state you go to. But each state will have its respiratory care board or some sort of a Department of Consumer Affairs that regulates healthcare providers. And you have to apply, and you have to link your credentials with your application so they can say, okay, great, you now meet the criteria to practice in our state. And that will be the licensure for that particular state.
What if somebody has a criminal background, and let's say, what's the range of criminal activity? I'm not saying like some kind of mafia, but let's say somebody's had a DUI in the past, or somebody's had, maybe they've been arrested for something minor. What's their chances of getting into the program, and also what's their chances of graduating and getting a job?
That's a good question. I can only speak to California regulations.
Okay.
I'm not aware of the other state regulations, but California is set up where they're understanding if it's one mistake, right? So they'll go back 5 years, and if it's within those 5 years, you may have to write a letter of explanation as to what it was and what you learned from it. If it's repetitive behavior, that may constitute a licensure denial.
Okay.
Right? So what we typically do is, when we have special cases like that, I'll typically call the Respiratory Care Board, and I'll let them know that I have a candidate who has this type of a past. What do you think? And they'll typically give me guidance as to
What the chances
this is
are.
something we can work with, or this is probably something, maybe this particular candidate ought to wait a few years, demonstrate ethical behavior, go through some counseling, go through some courses, and then we could reconsider.
Okay, so the best course of action is somebody should call their schools and ask what the chances are with their background, but being straightforward and open. Is it better to be open, or because some people I know hide their background, assuming it won't come out, and then towards the end they have to go get a background check?
Yeah, it's never a good idea to hide anything, but you don't have to go through a school. You could actually contact your state board directly.
So contact the board directly.
You could tell them you're interested in this particular profession. This is what you have in your background. What is their guidance? They're there to help you, and they're there to protect the consumer. It makes zero sense to actually hide that, because you're the one who's going to be allocating your resources and your time for approximately 2.5 years, only to find out now whatever effort you put in is not worth anything, right?
Yeah.
Because each state is going to do a very extensive background check. They will find out everything. And one thing that states like is if you let them know what it was, they look at that as a favorable thing. If they have to find out, that's automatic denial, and they will find out. So it doesn't make sense to put in all of this money, all of this effort, knowing that this is not going to result in a good situation.
Overall, if somebody does have a criminal hiccup, whether it's a misdemeanor or something, contact the board.
Yeah.
They're probably going to give the best help and advice as to whether it's going to hinder them from getting a career.
Absolutely.
Is this also, I know you don't know much about nursing or other medical professions, it's probably the same with them, you would think, too?
They all reside in this umbrella called Department of Consumer Affairs. Respiratory therapists have their own particular carve-out in California within the Department of Consumer Affairs, but Department of Consumer Affairs wants to protect the public from healthcare professionals who are unethical, right? But at the same time, they want to work with individuals who are looking to upgrade their skill set and better their lives. So it makes sense for you to reach out to them and let them know what your situation is, and they'll give you right guidance, whether it's to go through counseling or wait a few years to demonstrate ethical behavior. It's all designed to help both partners, the consumer and the prospective healthcare provider.
So I have a question about, you were saying earlier that you do interviews, like an entrance interview, or is it, what kind of interview, and is this unique to just your school? And what is the benefit of this, and what advice do you give to people that are coming in to help with their interview? What are you looking for?
To actually meet with the prospective student and do an interview is not a practice that happens everywhere. We have implemented that because, speaking with the hiring managers, they want to make sure that we're enrolling capable candidates who are going to be proponents of respiratory care. So my interview is generally more predicated on the behavior aspect.
And this is before they even apply to the program, or after they apply and then they're a candidate, and they're, like, where along the process do they get interviewed?
Yeah, so it's actually part of the onboarding process. So it's part of the application process. So once somebody's gone through, and let me speak to that a little bit. So if somebody comes in who's interested, they will first do an application. Then they would gather the pertinent documentation like transcripts, etc. They'll write an essay as to why they feel like this is a career pathway for them. And then we evaluate those metrics to determine whether somebody, and sorry, I forgot to mention, they also take an aptitude test. It helps.
And what's that exactly?
It's a test to see if they're able to, number one, read, write, and then process information. So it lets us know whether they have the basics of what we're going to be teaching them, basics to understand that. And it involves some mathematics as well. So it's got like math skill set, science skill set, English skill set, things that you would need to.
And it's more like a pass-fail, or is it like an A, B, C, or D?
You actually get a printout out of like a score of 50 to see where you stand. And then we have our own metric as where we draw the line. Like below this line, we will not give them an interview. But once you made it through that process, I like to meet with all of my candidates to determine their rationale for why they want to be a respiratory therapist. And it's not so much an interview for me, I look at it as an interview for my future student. And we talk about things like resources, what kind of resources they have in place to get through the next 18 months, right? We talk about support system, who they can lean on when the times are really difficult, because there are going to be some things that they have not thought about. And then we talk about organizing and sticking to a particular plan.
Is there anything during this interview process that would eliminate them almost instantly, things that they should avoid?
I would say there's some learning opportunities. I am open-minded to everything and everyone, where I don't look at it as like something that would eliminate them. But if somebody's, for example, late to the meeting, that is obviously not a good development, right? It shows that they're not interested enough to be there ahead of time. if they're not dressed professionally, that gives me some data points that they're not taking this seriously enough, right? So I want somebody who's focused, who's organized, who's really thought through a plan. That's who I want to have part of this program. And I know when I talk with the hiring managers, that's who they want to hire. So it makes sense to find that type of a right bridge. Now, if you showed up late or you didn't dress professionally for an interview, that's okay. We can talk about that, right? And then you can demonstrate that you were able to take that information and make those adequate changes, and I'll give you a second chance, right? I don't want to dismiss based on that, but I'm trying to also evaluate whether somebody's open-minded enough to take the constructive criticism and make it a part of their self-improvement process.
So it's essentially an interview that's going to be replicating an interview that they're going to have in the real world.
Absolutely.
And how well they do with you is a good reflection of how well they're probably going to do with a future prospect manager or employer.
Absolutely.
Okay, I have a common question that I get asked a lot, and this is probably once a week I get asked this question. How old is too old to get into a RT program? I have people that are, they're in their 40s, and they say, I don't know if it's too late, I don't know what I should do. And I have people that they're in their mid-20s, and they think that's too late. Is there a late, what is the cutoff now? Obviously, there's no cutoff for age, but what is the best recommendation? What's too, not necessarily too old, what's a time where it's probably going to be more difficult for you than not? What's that cutoff?
I don't think there is a cutoff. It's individual dependent. We've graduated over 1,060-ish approximately students over the last 16 years. So we're actually one of the biggest programs in California. And during that time, I've seen individuals who are in their late 50s, early 60s perform really well. As long as you're full of energy and you have the learner's mindset, you'll flourish because you are not only learning new things, but you can relate it with direct experience, right? What they bring to the table is something that are the type of intangibles that the employers are really looking for. They're prompt, they're professional, they know the proper etiquette, and they're able to take everything that they're learning and relate it directly with their life experience. Not only do they become phenomenal respiratory therapists, they're able to go right into supervisory and management roles because they see the gaps and then they become the solution to the problems.
So you say it's even an advantage sometimes to be a little bit older because you get to think, you already have the backing of wisdom and life wisdom to actually succeed a little bit.
Absolutely. Somebody who's young, they have the value of time on their hand. Somebody who's a little bit older, more experienced, they have the value of real life experience that they can relate to their new fundamental knowledge, right? So everybody has something to bring to the table. So it's everyone's own special journey. But the most important thing I would say is the mindset. So that's where one issue could be. Sometimes the more experienced students might push back, saying, well, I already kind of know that. And if you approach your education with the mindset that you already know something, then there's going to be some disconnects that may not be valuable. So going back to age, I don't think age makes a difference at all.
Age doesn't make a difference, mindset. You could have a 20-year-old that's more immature, or you could have a 50-year-old that's more immature. Mm-hmm. Has nothing to do with that. Funny story about that. In my class, somebody who's in their 50s, they got a job, and in the next year, their kid went in the same program and got a job also.
Yeah.
So mother, son, both got hired.
Yeah.
No problems.
No problems.
So in your opinion, what's the future of respiratory care? We kind of brushed upon it a little bit, but you said you graduated over 1,000 people. Do you think the market is now saturated, or is there future growth? What's the future of respiratory care? If somebody gets into it, is this a career that's going to be replaced by nurses, or is RT going to become its own maybe surgical kind of category?
There's been zero discussions about any type of replacement. from the nursing associations. They're not interested in something like that. They want respiratory therapy to be an add-on player in healthcare. And respiratory therapy has really established itself, not just in hospital respiratory therapy modalities, but also in home care, sleep studies, pulmonary function technologies, and pulmonary rehab. So there's multifacets to respiratory therapy. It's an established profession that is not going anywhere. In fact, respiratory therapy is actually still is like in infancy stage, where we're going to see tremendous growth in the future. In some of the most advanced circles, we're having discussions about advanced practitioner credential, where a respiratory therapist would be something similar to a physician's assistant, kind of like the nurse practitioner type of a setup. So, and then, the federal government and then the state government, they are not interested in disenfranchising any profession, especially an established profession like respiratory therapy. We are heavily counted on, as you know, with any type of infectious disease. Coronavirus was like the thing that put respiratory therapy on the map, but from your experience before that, we had so many other infectious diseases.
Almost every year, yeah.
Swine flu, you name it. Respiratory therapists are the first line of defense, generally speaking. So I don't see any movement towards taking anything away from respiratory therapy. I see respiratory therapy as a profession that's expanding currently, and will continue to experience expansion into the future. What the expansion actually looks like is anybody's guess, but projections are that infectious diseases are on the rise. Coronavirus and related viruses are not going away anytime soon. And then smoking itself has always been a big issue. So we've had lung issues, and asthma has always been with mankind for a long time, and I don't see that going away anywhere soon. So respiratory therapy is here. It's here to stay, and it's going to continue to experience growth.
So there's people that ask about, are there options outside of the hospital setting? You kind of brushed upon pulmonary rehab, sleep lab, things like that. Would you be able to just tell people what else can you do outside of the hospital, and is there any future developments? Are there going to be clinics for respiratory anytime soon? Is that something that's in the future?
I don't see any movement towards having clinics for respiratory therapy, although I'm advocating to have respiratory therapists as part of telehealth.
And what is telehealth?
Telehealth is a medium very, very closely related to technologies like Teledoc, et cetera, where you're able to reach your physician through like a Zoom or a Teams type of a modality. We feel like respiratory therapists can really help in that regard when it comes to training on breathing techniques or proper usage of respiratory therapy devices. But going back to other avenues for respiratory therapists, we're starting to see a shift where healthcare is no longer confined to this box called the hospital, right? Healthcare actually happens in the community and so many other areas. So you're going to start to see respiratory therapists in pulmonologists, doctor offices. Respiratory therapists already are established in pulmonary function technology, where we do the different lung functions. We're starting to see expansion in home health, and we're starting to see a lot of concentration in pulmonary rehabilitation. I feel like that is just starting at this point. Currently, if you're a respiratory therapist who graduates from an RT program, about 90% of you guys are going to go directly to work in a hospital setting or a post-acute setting. But then we're starting to see a huge shift towards outside of the hospital care. Nurses are doing that, physicians are doing that, and respiratory therapists are following suit. You're going to see the future of healthcare really evolve, where critical care will happen in a hospital setting, but we're trying to prevent cases from becoming critical by having lines in the community that patients can possibly tap into.
Okay, so it's because it's a relatively young career, there's still a lot of growth for respiratory. So if anybody comes in RT now, they have a big future and they could always deviate and shift to a outpatient, more clinical environment later on in the future.
They could get into education, they can get into management, they can get into the C-suite for the hospital systems.
And what's C-suite?
This is anything with the chief next to your name, like chief operations officers or chief financial officer or chief executive officer.
And in order to become any kind of management in a hospital, do you typically need an associate's degree or a bachelor's degree? Does it matter state to state?
So for advancement, it depends on exactly what your long-term goal is. If you want to get into healthcare management, you at the very minimum should have a bachelor's degree. It doesn't have to be a bachelor's degree in respiratory therapy, but it has to be some sort of bachelor's degree, preferably maybe management, right? And then you could do your master's in some sort of hospital management to better improve your chances of getting that type of a job.
In terms of other states, you probably don't know too much about them. To become an RT in California, do you need a bachelor's degree, an associate's degree? What level of education do you need?
Yeah, actually, I could speak a little bit more to other states as well. Currently, associate's degree is required to be a practicing respiratory therapist in any of the states. You do not need a bachelor's degree currently in any state, although there have been some discussions about that. And we're probably going to start to see a shift towards bachelor's degree respiratory therapy in the coming 4 to 5 years.
So kind of like nursing, I think nursing recently has started transitioning over to bachelor's degrees over associate's degrees. Same thing with respiratory.
To define transition, it might be a little bit more complex because if you're a hiring employer, right, and you had 2 candidates, one had an associate's degree, one had a bachelor's degree, they both have license to practice. So the licensure has not stated whether nursing or RT need to have the bachelor's credential, or bachelor's degree.
Okay.
You just have to have a license, right? But as a hiring manager, you're probably gonna move more towards taking somebody who has a bachelor's degree because your thinking process leads you to believe that they probably have better skill set and improved intangibles, right? And that's really what everybody's looking for. So if somebody has a bachelor's degree, I would lean towards hiring them over somebody who has an associate's degree. But licensure is not based on that. Every state in the nation is saying associates respiratory therapy is what we need.
So in terms of schools, there are a lot of questions I have about what kind of schools people should attend. There's the kind of community colleges, and there's also more program type schools. What are the disadvantages and advantages of both, if there are any? Does it really change anything? What's your prospect of getting hired if you go to one versus the other? And what's the education status? Are you going to be a more educated one? Are you going to have more hands-on in one? How does that work?
There's a accrediting body called Committee on Accreditation for Respiratory Care, and we can embed their link into our description as well.
And that was Committee for?
Committee on Accreditation for Respiratory Care,
okay.
COARC. Okay. They want to make sure every program, whether it's a community college or a technical college, abide by the same set of rules, and they produce a similar type of outcome. So regardless of which program you go to, you should receive a very, very similar education with the other, right? So a community college should give very close to the same type of education that a technical college gives, and vice versa.
Now, COARC is for the nation or just California?
COARC is for the entire nation. So they oversee all respiratory therapy programs, whether they're technical colleges or community colleges or private community colleges, okay? Now, does one give you advantage over the other? I think is predicated on the region and how well the program may be put together. I don't think you can make a case that just saying technical or community is better than the other, but you can make a case based on outcomes. So if the link I'm going to provide you will take viewers directly to the COARC's ranking of all colleges based on their outcomes.
Okay,
And
so these links will be in the description of this video.
Yeah. And then you will be able to track things like retention, on-time graduation rate, first-time pass rate on board examinations, and placement, which is their way of saying how many people are getting a job after they complete the program.
And this shows every college in the nation?
Every college that is respiratory therapy college in the nation will be listed out on their last 3-year working averages,
Okay.
Year by year. So you really need to look at that data to evaluate which program is better suited for you. Now, if you're in a rural community where you only have one RT program within 250 miles, that may be your only choice. But if you're in a different region where you have 3 or 4 to select from, this data will help you drill down as to which one is better, right?
Okay.
So I would say that is step one. Okay, you look at the data, you try to see who has good outcomes. I would even go in a little bit further if I was a student looking to research. I would reach out to some of the hiring managers. So you call the medical center in your community, reach for the respiratory therapy department, and ask them.
So just through the operator?
Yeah.
And just say, can I speak to the RT department manager?
Right.
Okay.
Or make a visit down there. These are well-meaning people. They want to make sure people are, the people who are really focused are the ones who are getting into the programs. So they will give you FaceTime and they'll answer your questions. They'll let you know which program they like to hire from. To me, that is valuable data, right? As somebody who's a prospective student who's looking to get into healthcare, I'd want to know who the managers typically hire from and why, right?
So that's going to be okay, though. The managers would be okay with this, or
they should be okay with it,
they
right?
should be okay with it. Okay.
The other things you can do, I mean, to me, if I'm a manager, it shows this is a proactive person, right? I have vested interest in helping them because if they succeed and I bring them to my team, right, my department is going to be that much better. Okay. So anybody who's a long-term thinker and a good manager, they will make the time to meet with those individuals. The other thing I would look at is the length of the key personnel with the college. So if you're looking at the data and everything looks great, but then you have to match it up with how long have the key personnel been there. Each respiratory therapy program in the nation, based on COARC's guideline, they all have to have a program director and a director of clinical education, right? And you need to know how long those people have been with the college.
So the directors, the leaders, the people in charge. Now, how do you get that information for anybody? Or do you just call the school and ask?
Right. You would call the school and you would ask for that because in their website they should have something like that, or you can call directly and inquire. Because if the outcomes look great, but the new leadership has only been there 6 months, those outcomes may not last because those outcomes are reflective of previous management style, right? So I would look at those types of data points when I'm making my decision.
So when choosing a school, so the best thing to do is call managers in the community at the hospital and ask them, what school should I go to? So if you're in a rural town in Montana and you call the manager, say, hey, what school is the best school for me to go to? They'll kind of steer you into a direction. Then you go on that website.
Predicated Montana has multiple schools to choose from, right? They may just have one. I don't know. But let's take that and let's apply it to Ohio.
Okay.
You call the medical center in Ohio. Let's say they have 4 or 5 RT schools. And you can ask the manager, which school do you think is better, right? Let's say you don't get those answers and you need to just kind of still make some sort of informed decision. Talk to the graduates, right? Talk to some of the people who recently graduated from those programs. I bet you they're working in the respiratory therapy departments within your community. Talk to them. Find out what their experiences have been. If none of those options are there, I would like to know how many clinical sites or how many hospitals support that particular program. Generally speaking, you will see anywhere from 6 to 8 different hospitals that support a respiratory therapy program. Our program, being as large as it is, we're actually supported by 40 different hospitals. So I know it's quite unique. We have an immense footprint when it comes to clinical affiliations. We may even have the biggest in the nation.
We're very unique, yeah. We have so many, it's not like any other city.
Right. But that kind of data point lets you know if 40 hospitals are supporting this program, it must have pretty good reputation, because there's no money that changes hand when it comes to clinical externships.
Okay.
Right? We're able to align with the hospital. They're able to provide us their workflow and their patients, and then we're able to send our students there, and what they gain is they're able to evaluate our students to see if they're going to be good employees for them, right, without actually hiring them. So that's a symbiotic relationship a program has with its clinical affiliations. So start by going to COARC, start by looking at the data, look at the key personnel, see how long they've been there, talk to the RT managers. If they're not available, talk to some of the graduates who are working as respiratory therapists, and then look to see how many hospitals actually support that particular program. And that'll let you know which one is right for you.
Okay, so this is really good advice, because I do get asked these questions a lot. So essentially, you have to be very proactive. You have to get out of your way, make a lot of phone calls, kind of go up and beyond.
You know, you do have to do that, but I wouldn't look at it that way. I would look at it as I am trying to grow my skill set, right? If you want to improve your chances of getting hired, right, and you met with somebody before you got into the program and you took their advice, guess what? They're part of your network now. They're going to advocate for you when you graduate. They might bring you on because they're like, wow, you know, not everybody asks to meet with me to get into, to see if they want to get into respiratory therapy.
That does
right?
make sense, yeah.
People are there to help you. All the professional people that I meet with, they're all well-meaning. They all want to help the next person in line. They're not there to be scary people at all, right? You just have to put yourself out there. So what if somebody says no? Who cares? They're lost, right? Go somewhere else. You're developing your own skill set on networking. You're developing your own skill set on upgrading your ability to talk to people. The more you put yourself out there, the more you're going to learn. Learning is not just going to come to you, right? You're going to have to put yourself in some uncomfortable situation. When you went to school, right, it was an uncomfortable thing for you.
Oh yeah, definitely.
Right? But look where it got you.
Yeah.
These things are just not going to happen automatically, right? So if this seems like, oh my God, I'm doing so much legwork just to evaluate the program, yes, you are doing the legwork, but you may not realize it, but it's making your chances of getting hired after the program so much easier because of the legwork you did now. And remember earlier on, you were saying, hey, this is like 3 months before, right? And I had recommended, hey, work extra, do some of these things too, right?
Okay.
Put it all together. This should be fun. This should not be like, oh my God, I have to make a phone call. Mm-hmm. Yes, you have to make a phone call. Oh my God, I have to go visit a hospital. Yes, you have to go visit a hospital. So what, right? Do these things because nobody else is doing them. And it's going to separate you from the herd, right?
That makes a lot of sense. This applies across the board.
Across the board.
From whether it's nursing, any kind of other profession. So why respiratory? Why should anybody become an RT? I know that when I was in school, they made everybody answer the question, why did you want to become an RT? Yeah. But nowadays, with Corona, with everything that just happened, it seems like a dangerous job. Do you still recommend it? Why should anybody become an RT?
It's as dangerous of a job as it always has been, right? Healthcare is dangerous, but we have protective equipment that causes or creates a barrier between us and the infection that may be there. We follow our protocols. We always have. Why respiratory therapy? It's an individualized thing. If you like to move around throughout the hospital and you want to be challenged and you want to be the go-to person when emergency arises, then you should consider being a respiratory therapist. If you don't enjoy that, then do not become a respiratory therapist. If you've seen any type of healthcare-related programming, who do they call overhead when emergencies are happening? They say, RT to ER stat. You're like, oh, that's me. I better go do that. If you enjoy that, right, then you should want to be a respiratory therapist. If you're like, there's an emergency and they're calling me, I don't know if I can handle that, then maybe you should not be a respiratory therapist, right? So if I would imagine a lot of people who view this type of content, they probably ascribe to, like Dr. House, or they watch some of this type of stuff on television.
Dr. Mike on YouTube.
Or Dr. Mike on YouTube. I don't know who that is, but
You don't know who that is?
No.
Oh, okay. He's pretty good.
Yeah, but that kind of lets you know in your dream environment who do you want to be, right? If you like to be energetic and you're not just tied to one unit, you're responsible for basically everything that could happen in the hospital, and you're a good team player, then I think respiratory therapy is the right fit, because it fills your cup in so many ways, right? But if you want to be stagnant and just work on one thing, then master that, focus on that. This isn't about bringing somebody to respiratory therapy. It's about, no matter what you choose, nothing is going to be just handed to you. You're going to have to go out and get it. You're going to have to work at it. If you like just being behind a computer screen, then master that, right? There's so many professions there. If you want to be in healthcare, there's so many avenues in healthcare. You could be a radiology technologist. You could be a respiratory therapist. You could be a pharmacist. You could be a physical therapist. You could be a hygienist. You could be a dietitian. You could be occupational therapist. It goes on and on and on. The list goes on based on your specific preferences. I kind of fell into respiratory therapy. You heard my story, but I've been in love with it since day one. Right?
You never regretted becoming an RT?
Never regretted, never regretted it, because number one, I felt like I was given an opportunity. Number two, I've always gone home feeling like it fills my cup. It brings me a lot of joy. And now I focus on building up others to have that same exact feeling. So I think knowing a little bit about yourself is very important, and knowing about the profession is very important.
Have you met anybody who has regretted becoming an RT?
I'm sure I have. I can't recall a specific dialogue about it as to somebody who regretted becoming a respiratory therapist, but what comes to my mind is situations that we saw during COVID, right? I raised my hand to say, I like to help during COVID, even though I'm more of an educator, not a practitioner, but I was able to help do my small part during that. And I saw a lot of people who were working constantly, the real heroes, right? The ones who were always there, and they did 7, 8, 10 days in a row, and they were just exhausted. I don't think even in those moments, they regretted becoming a respiratory therapist, but they regretted those situations, right? There are specific situations that unfold that are beyond your control sometimes. COVID
So they were
being one
more
of them.
overwhelmed.
They were overwhelmed, they were overworked, they're filling in the gaps, right? Because there's a huge shortfall in practitioners at that point, right? And the demand is gone up exponentially.
So how has respiratory therapy, not only the career, but the schooling changed since COVID? Has anything changed, or is it roughly the same as pre-COVID?
I think we're starting to see the initial changes within the profession, and those are more in line with, we need to tap in early to see what's going on with the individual therapist. What is the engagement level like, right? We need to measure that early on and provide the right resources to keep them engaged. Because you have probably seen in your work where, whether it's respiratory therapist, nursing, pharmacist, MD, we've seen a lot of people say, you know what, this is just not the right thing for me. I gotta walk away, right? So within it, there's some research that's going in where we're trying to look to see early signs as to why that's happening. Can we save some of those people? And then some of that is translating into education where the students are very motivated, they're well-meaning, and they want to go in there with a lot of energy. But at the same time, we want to make sure that they're doing it for the right reasons. And what I mean by that is if you're getting into respiratory therapy or nursing or any healthcare related methodology for money, it's not going to work for the long term.
So in terms of selecting a program, we kind of discussed the best thing to do is if you are interested, just to kind of overview what we were discussing, best advice for if you're planning on going to the RT program, work hard, save up money, kind of plan ahead, call as many hospitals as you can in your area, also call the school, contact the board, get as many questions answered. In terms of, sorry, go ahead.
You don't necessarily need to contact the board. You just need to go to their website. They have
Just
the questions.
the website would have the answers.
So something that will make any student fail is, number one, if they fall behind. And the way you typically fall behind is if you're not sticking to your plan. So you have to have a plan mapped out, and you have to really look at this as a full-time job. So if going to school is your full-time job, it's going to require adequate amount of hours. And then, unlike a job, we're actually going to assign homework. So you have to have time set aside to actually do the homework, right? And then on the weekends, you need to read up on what's going to be coming up. So types of things that derail my students is lack of organization. If somebody is not organized enough, if they're scattered and if they're procrastinating about everything, that will definitely derail them. But I want to answer your question with a solution, right? So what you want to do is you want to go, number one, buy an organizer, list out your time, look at school as your full-time job, and stick with that particular plan. If you're not sticking with it, have people get involved. Let your family members, let your support system know exactly what you're embarking on so they can keep you honest.
So another question I was asked is, how involved are you guys in helping someone find a job? How much do you guys help with clinicals? What's your level in terms of your school at least? Which I'll have the link to his school in the bottom. Is that okay?
Yeah, that's fine.
Okay, if anybody has any questions for maybe they are interested in your school, is there a number that I should put on the bottom?
Well, actually, I'll give you my email address, and anybody who wants to inquire, they can reach out to me.
They can just reach out directly
Yeah.
to you? Okay, perfect. So I'll have that in the description if anybody is interested in asking any questions about this job. You're in the Sacramento community?
Yeah.
How far out do people usually go to this school?
Yeah, so we're in the Sacramento region, and we typically have clinical placements as far out as the Bay Area. We even go into Nevada for some of our clinical practicum. And we, as I mentioned before, are supported by a lot of hospitals that are within the region and beyond the region. So our school helps prepare all the students for their clinical practicum. So when they get to their clinical sites, they're well prepared because we've done a lot of modalities here on hand in our lab settings. And then post-graduation placement is the number one thing that I track. That is our measurement tool to make sure our graduates get a job at the end of their education journey. So what we do is we outline who's hiring and we present that information to our graduates. Of course, we cannot go and interview on their behalf. They have to actually go and do that. But we will develop that kind of information. We help our students write resumes. We do mock interviews here on our campus where actual hiring managers will actually come to our campus, or hiring managers from outside the state will do a Zoom call with the students to interview them. And sometimes that'll lead to a job offer right away, even though it's a mock interview,
Okay.
right?
What about clinical placement? Do you guys place the people? Do they place themselves? How does that process work for externship?
Good question. For externship, we take 100% accountability to schedule our students and then ensure that they are doing the skills at their respective hospitals that we need them to master.
Okay. So honestly, this is really great. You gave some really good answers. I'm really happy with this. Overall, just to wrap everything up, what's the one piece of advice that you'd give to a prospect, somebody who wants to go to RT school, somebody who wants to go to become an RT? What's the one piece of advice you'd give them?
I would tell them, do your research, do some legwork beforehand. Really try to figure out if this is the right time for you, because this may be the right thing for you, but you may not have the resources, or the support system is not as put together as it needs to be for you to thrive in this program. You want to situate yourself for success, and you do that by being proactive. You need to know that for 18 months or 2.5 years, depending on the length of your program, you will not have any social life, right? You will need to have a lot of resources to get through. You most likely should not be working. I know you have to work. I had to work when I went to RT school. I know you had to work when you went to RT school. It's just another layer of complexity that you have to overcome, right? So going in, number one, know yourself. Number two, try to know what the program is like. Try to understand the expectations. And then once you sign on to a program, really immerse yourself into your studies, right? Don't think of this as like, okay, this is my professional self and then I have my separate self. You should become your professional self, because that's what's going to help you succeed.
So by immerse yourself, you're saying kind of step into the role of as if you already work as an RT.
Yeah, and anybody who's been successful at respiratory therapy, they will tell you that the respiratory therapy program is really your job interview. So it's like an 18-month or 2.5-year job interview. How you perform during your education is going to determine what kind of job you're going to get, or if you're going to get a job at the end of this, right? So within that, you have to have a little bit of introduction to what is known as game theory, right? Which shows, okay, if you're a cohort of, let's say, 30 people, and you graduate about the same time, and you're going to take your board examinations about the same time, some of you are going to get hired before others. That's just the law of numbers, right? Now, some of those who get hired first, they're going to be brought on to future interviews when other candidates from the same cohort apply. And the manager's going to pull you in their office and say, hey, Daniel, do you know this person? What you say now is going to make or break whether that person gets an opportunity, right? So the game theory says, don't put so much about yourself out there when you're going to a program, right? Don't talk so much about yourself. If you want to be an interesting person, show interest in others. That's how you become an interesting person. But the more you talk about yourself, the less likely it is that you're going to get jobs. So I'll just give you some examples of where I've seen horrible outcomes. I'll typically have 3 to 4 students who are going through the program within a particular cohort where they are already working in a hospital. Let's say they're working at a particular system. They see that as they already have their foot in the door. So maybe they don't need to hit on all the metrics to be successful. But what generally happens is if they're banking on that, that usually doesn't transpire in a positive direction, because if you're part of, let's say, a union, prospectively your seniority is going to transfer over. So sometimes you may have a preceptor who's like, well, if this person gets hired, right, they'll get the preferential schedule.
It's a very common thing, I think, in the healthcare field.
Right?
Yeah.
So students at their level don't have the right comprehension of what they're putting out there in front of their classmates, right? So you really have to be careful. Like, sure, be yourself. I'm not saying not to be yourself, but also be want to be yourself in a very professional way.
Okay, so
right?
pretty much treat school as if it's your job already, and
Absolutely.
and treat it as an interview for. And you said it's about 2 years roughly. Are most programs roughly the same, plus or minus a few months?
The program I went to was like 2.5 years because I had to
Okay.
do some prerequisites. There are some programs like ours, for example, it's like an 18.5-month program. It's an accelerated program. So that's why I talk so much about making sure everything is on point and you're organized because we're still taking the same amount of content and we're condensing it. So you can look at anything from like 18.5 months to 2.5 years.
Okay, so roughly that time period. And so during those whole 2 years, plus or minus a few months, treat it like an interview. Don't talk too much about yourself. You never know who's listening. You never know who might like you, what kind of drama might unfold. That's the advice you give.
Absolutely.
Oh, that's actually really
These
good.
are make or break things that you learn through experience, right? After I've seen, over 1,000 graduates, you get a sense of who is going to succeed, who is going to have some issues, and why.
And off the top of your head, you probably don't know a number, so I'm not going to ask the number. But generally, do most people, most is a pretty appropriate question, do most people find a job after they graduate?
They should.
They should. Do they, in your experience from your school in particular?
Yes.
They do. So most people do find a job. So I do have people ask me, how hard is it to find a job after I graduate? And generally, a lot of people find a job, if not close to all, or like where would you, not a number-wise, but where would you put it? A lot of people find a job?
Yeah, I mean, a very, very high number of people find a job. And again, this is something you can look at when you go to the COARC website. It'll let you know on a 3-year running average, what is the employment rate for your said particular college
Perfect.
that you're looking at. And that is something you should dive into. But I would say I probably have graduates working in every state of the nation, right? Because they had the mindset that they were going to go wherever the job is, right? And you work in the Sacramento region, at the medical centers here, majority of the practitioners are my graduates.
Yeah, I work with a lot of people that went
Yeah.
to school with you.
Yeah.
I mean, that went to school into your program.
Our program is not a public program, it's a private program. We have a vested interest in making sure every graduate gets hired. Everything is a business, right? Education is a business as well. Apple makes iPhones, we make graduates. If somebody isn't purchasing iPhones anymore, I'm sure Apple's going to reconsider how many iPhones they make.
That's true.
Right? So we want to make sure everybody is purchasing our graduates, meaning they're hiring our graduates after they graduate. If that doesn't happen, we have to reconsider the whole thing.
So it actually hurts you more if they don't get hired.
Absolutely.
So it's in your best interest that people do get hired. Okay. And so that's really good advice. If you guys have any questions, definitely leave the comments down below and ask any questions. If you do like this, I could have a part 2 with any other questions you guys have in mind. Let me know what you guys think. Thank you very much for coming. It's been a pleasure to talk to you.
My pleasure.
I love the answers. Have a great day, guys.